Good morning, guys. Uh, uh, let's start the class. Today, I'm going to talk about fractures which are, named after certain persons who discovered it or who invented it or who described it for the first time. These are called fractures with eponym, as well as what happens when joint, muscle, tendon, and ligaments are injured, how we diagnose them, and how we treat them. So this is the last general topic in traumatology. After that, we'll enter into the upper limb, okay, trauma of upper limb. Please mute yourself. Now, let's start. Some fractures are better known by particular names, and most of those names are given after the person who described them first. Okay, mostly. Sometimes, they are the name is given after certain other things also. But eponym means usually the name is given for that particular fracture who has described it first. Now, some of the very important, questions that may be asked, especially in your MCQ exam. This topic is important for the MCQ exam. Okay, we just name the fracture and we discuss what is the meaning. So here, Monteggia fracture dislocation. What is the meaning? Monteggia fracture dislocation. Now, this means fracture of the proximal third of the ulna with dislocation of head of the radius. Now, I want all of you to focus on this screen. You can clearly see here is the ulna bone. Let me use the pointer here. See this. This is the ulna. The broader bone is ulna, and this is the proximal third of the ulna, means the upper part of the ulna, isn't it? It is fractured here. At the same time, look at this lateral view. This is okay. AP view. Sorry, this is AP view. This is lateral view. In this AP view, the head of the radius looks a bit dislocated from its attachment. See here. Okay. So these two things together is called Monteggia fracture dislocation. So one of the important point to note here is both things are occurring in the upper part of the ulna or towards the superior end of this radius and ulna bone. Whereas Gallagher fracture dislocation is another important fracture with eponym. This means fracture of the distal third of the radius with dislocation of distal radioulnar joint. Now we will focus on the radius bone. So this is the radius bone here. This is the fracture of distal third of the radius, and look at this joint. This is distal radioulnar joint which is dislocated. So Gallagher fracture dislocation. Monteggia fracture regarding the ulna, fracture of the ulna. Gallagher fracture is associated with fracture of the radius. Now I will give a small, mnemonic or clue how to remember this. Remember, Monteggia starts with M, and ulna bone is also on the medial side. If you stand in the anatomical position, ulna is also on the medial side. So this is the very easy way to remember. Otherwise, it is a bit confusing for the students in the beginning. Let's move on. Another important name is called Colles fracture. Colles fracture, very, very important from the exam point of view. And it is one of the commonest fracture that happens in elderly people. A fracture occurring in adult at the corticocancellous junction of the distal end of the radius is called Colles fracture. Now see this, corticocancellous junction. The lower part of the bone is made up of cancellous bone, and the shaft is made up of cortical bone. So junction of corticocancellous area is fractured in the distal end of the radius. There is a typical displacement here, and that displacement is called dorsal tilt. Okay, dorsal tilt. It looks like fork deformity or dinner fork deformity when the patient comes to the hospital. So this is exactly what happens to the patient in Colles fracture. Now, another is Smith fracture. What do you mean by that? A fracture occurring in adult at the corticocancellous junction of the distal end of the radius with ventral tilt now. With ventral tilt and other displacement. And this is exactly reverse of Colles, opposite of Colles. In Colles, it's a dorsal tilt. In Smith, it is a ventral tilt. Otherwise, it occurs at the same area. See this, corticocancellous junction of the distal end of the radius. Corticocancellous junction of distal end of the radius. Only a difference is the displacement. Smith fracture, ventral tilt. Colles fracture, dorsal tilt. Now, look at this picture here. This X-ray of the wrist, AP and lateral view, showing a Colles fracture here. Colles fracture. If I look at this lateral view, I can clearly see there is a dorsal tilt. And this is a typical fracture line. This is a corticocancellous junction of the lower end of the radius. So Colles fracture. Let's move on. Some other fractures, okay, with eponyms are night stick fracture. The meaning is isolated fracture of the shaft of the ulna sustained while trying to ward off a stick blow. Somebody has hit very fiercely with a stick. Okay, that is the meaning. Please mute yourself. We are getting disturbed. So this is isolated fracture of the shaft of the ulna sustained while trying to ward off a stick blow. This is night stick fracture. Another is Barton's fracture, okay, also known as marginal fracture. Now, what is the meaning? This is an intra-articular fracture through the distal articular surface of the radius, taking a margin anterior or posterior. You can clearly see in this picture, this is anterior type of fracture. Here is a posterior one. See this? This is a distal articular surface of the radius. This is Barton's fracture. This is intra-articular fracture. Now, another one is a Chauffeur fracture. This Chauffeur fracture is again intra-articular fracture, and it is involving the styloid process of the radius. We all know what is the styloid process, isn't it? It is present on the lower end of the radius. Okay, so that is affected in Chauffeur fracture. There is nothing to explain here. These are just the names. Okay, so at the end of this topic, I'll definitely tell you what are more important eponyms than other. Bennett's fracture dislocation. This is one of the important one. It is an oblique intra-articular fracture of the base of the first metacarpal bone. Now, base of the first metacarpal bone. So it is towards the thumb now. The base of the thumb, you can say, with subluxation of the trapezio-metacarpal joint. This is Bennett fracture dislocation. It exactly happens like this. There is another fracture which is quite similar and occurs at the similar site, that is called Rolando's fracture. And this Rolando's fracture is extra-articular fracture, whereas Bennett fracture is intra-articular one. So try to remember this. These are important questions from the MCQ point of view. So let me repeat. Bennett fracture is intra-articular one, which occurs at the base of first metacarpal. At the same time, there may be subluxation of the trapezio-metacarpal joint, whereas Rolando's fracture is extra-articular one. Now, Boxer's fracture. See here. What do you mean by that? It is a ventrally displaced fracture through the neck of the fifth metacarpal bone, which usually occurs in boxers. Through the neck of fifth metacarpal bone. While involving in that boxing in the ring, they may suffer from this type of fracture. Now, another is side swipe fracture. Now, side swipe fracture. What do you mean by that? Sometimes what happens, small babies or children, when they are inside the bus or inside the car, they stick their elbow outside the window, and if another vehicle is passing from the side, that vehicle, okay, may hit their elbow or their hand or forearm. So this type of fracture is called side swipe fracture. Now, what are the type of injury here? It is an elbow injury sustained when one's elbow projecting out of a car is side swept by another vehicle. It has a combination of fracture of the distal end of the humerus, because it is a part of the elbow, with fracture of proximal end of radius or ulna. So this is a fracture around the elbow joint. It is also commonly known as baby car fracture, because babies usually do that. Side swipe fracture. Let's move on. There are so many other. Now another is called bumper fracture. Now, bumper fracture. Now this bumper, okay, is named after the bumper of a car. You see this? It is a comminuted depressed fracture of the lateral condyle of the tibia. So lateral condyle of the tibia fiercely, hit that bumper part, and then there is a comminuted fracture. Now let me ask you, what is comminuted fracture? What do you mean by that?
Multiple fractures are there.
Multiple parts in the one fracture.
Exactly. Okay, every student know that, because this is quite a basic question. The multiple pieces or multiple fragments are there in the fracture site. Comminuted fracture. So this is bumper fracture. Now Pott's fracture. Pott's fracture means this is the ankle fracture where both malleoli are fractured. So we have got lateral malleoli or malleolus and the medial malleolus. The medial malleolus is a part of tibia bone and lateral malleolus is a part of fibula bone. So if both of them are fractured along with the lower part of the tibia and fibula, we call it Pott's fracture. Another important term is called Cotton's fracture. Now this cotton fracture is a trimalleolar ankle fracture. Now you may be wondering, what is that third malleoli now? Isn't it? Trimalleolar means three. So we already know the name of two malleoli, lateral and medial. Now the third malleoli is, see there, distal posterior aspect of the tibia. So distal posterior aspect of the tibia is fractured along with two malleoli, and we call it Cotton's fracture or trimalleolar fracture. Now I want to show you one X-ray here. So see this. This is a trimalleolar fracture or Cotton's fracture. Look here. This is a lateral malleolus. This is the lower end of the fibula. Here is medial malleolus. Okay, this is a part of the tibia, and this is the the distal posterior aspect or part of the tibia. So this is posterior malleoli. This is medial malleoli. This is lateral malleoli. All three are fractured. We call it Cotton's fracture. Now there is one other important name which is called Maisonneuve fracture. Okay? Maisonneuve fracture. It is a bit difficult to pronounce. So that means the spiral fracture of the proximal third of the fibula, which is associated with a tear of distal tibiofibular syndesmosis and the interosseous membrane. Now, in the first class which I provided to you, there was normal anatomy of the bone, cartilage, and the joints. So I'm not sure how many of you have gone through that. Now let me ask you some question here. What do you mean by syndesmosis? What is syndesmosis? Anybody? Anyone who feels confident to answer? Syndesmosis. What do you mean by that? Or what is the interosseous membrane? Your answer is right there. What is interosseous membrane?
The introsseous membrane is a membrane between the tibia.
The membrane which cover the joints. It's called
Membrane
interosseous
which
membrane.
connects two bones is called
And two
interosseous.
joint and two
Okay,
bones.
very good. Sufyan, Mujib, and Saad all are answering, almost the same thing. Interosseous, the answer is right there. In between two bones. This is a very thick membrane which connect two bones together, and this is present between tibia and fibula in the lower limb and between radius and ulna in the upper limb. Okay, never forget it. Interosseous membrane is present between tibia and fibula in the lower limb and between radius and ulna in the upper limb. Now, this interosseous membrane is known as syndesmosis. It is known as syndesmosis actually. So the distal tibiofibular joint, okay, has a syndesmosis if that is turned along with a fracture of proximal third of the fibula. We call it Massonnet fracture. And very commonly, there is associated fracture of the medial malleolus or rupture of the deltoid ligament of the ankle in this case. Deltoid ligament is a very strong ligament around the ankle joint. It is present on the medial aspect of the ankle joint. This is called deltoid ligament. It is present towards the medial malleolus. It is important regarding the stability of the ankle joint. Now, let's move on. Let's trying to explore some other eponyms here. Pylon fracture. This pylon fracture means it is a comminuted intra-articular fracture of the distal end of the tibia. Okay, this is pylon fracture, comminuted and intra-articular of distal end of the tibia. Aviator's fracture is fracture of the neck of the talus bone. Now, talus bone is present where? What is talus bone?
The
Tarsal
ankle.
bone.
Present in the lower limb.
Exactly. It's a part of the lower limb bone and it's a tarsal bone. Excellent. It's a tarsal bone, talus. And this talus is one of the main bone which forms the ankle joint. Remember that. Okay. The lower bone of the ankle joint is mainly formed by talus. Now, another is Chopard fracture dislocation. This is fracture dislocation through intertarsal joint. Intertarsal joint. Okay, in the lower limb again, especially in the foot area. Jones fracture is avulsion fracture of the base of fifth metatarsal bone. Now, what is avulsion fracture? I want to hear some answer. We have done this before. What is avulsion fracture?
Fracture which is occur by a injury, uh,
Yes, yes.
high grade injury like hit by a vehicle.
Okay, fine,
So
fine.
the type of fracture, sir, in which it moves the joints along with the bone, sir. The muscles also involved in this case, sir.
Okay, good. Any other? Okay, now let me explain this. Avulsion fracture means, remember, a very small piece of the bone, okay, is detached from the main bone by a fierce pulling. For example, there is a vigorous muscle contraction, and if this muscle is attached to that small pointed part of the bone, that piece of the bone is separated from the main bone. That type of fracture is called avulsion fracture. Or sometimes even the fierce type of injury can do so. Okay, but mainly it is because of the vigorous contraction of the muscle which is attached to that particular part, and it usually leads to small piece of the fracture which is displaced away because usually it is attached to the muscle. Now, Rolando fracture, we already talked about, if you remember. Rolando fracture is very commonly confused with Bennett fracture dislocation. Bennett fracture is intra-articular fracture of base of the first metacarpal bone, whereas Rolando is extra-articular fracture. So that's why it is a commonly asked question in the MCQ exam. Okay, so let's move on. Some other fractures with eponyms are Jefferson fracture. Jefferson's fracture means fracture of the first cervical vertebra. Now, what is the name of first cervical vertebra? We have got a name there.
Atlas. Atlas.
Atlas. Very good. The name is Atlas. Okay. Second cervical vertebra is called axis. Atlas and axis. So fracture of the atlas is Jefferson's fracture. Another is whiplash injury. This whiplash injury is a very common term. It's asked in the exam. Now see here, please pay attention. This is a cervical spine injury where sudden flexion followed by hyperextension takes place. Sudden flexion followed by hyperextension takes place in case of whiplash injury. Like there is a, you are inside the car and the car is in very high speed. Suddenly, okay, something has come in front of the car. So you have applied the brake. During this time, if you have not wear any seat belt, then what happens? This type of injury can very commonly occur in the cervical spine. And you all know, if cervical spine is fractured, there is a high chance of quadriparesis or quadriplegia because of damage of the spinal cord. At the same time, phrenic nerve can also be damaged, resulting in paralysis of diaphragm. So cervical spine injury is very serious in comparison to all other vertebral injury. Chance fracture. Now see this. It's very easy to understand. This chance fracture means it is also known as seat belt fracture. That is, the fracture line runs horizontally through the body of the vertebra, through to the posterior element. It is again, sustained during the motor vehicle accident. Chance fracture. So it is caused by the seat belt fracture, also known as seat belt fracture, I should say, because it is associated with seat belt. Now, March fracture. We have given this example in the general discussion of the fracture classification, if you remember. March fracture, this is fatigue fracture of the shaft of second or third metatarsal bone, and it is very commonly found in soldiers or army personnel or even police, because they keep on standing and they keep on walking for a long duration, and this is a type of fatigue fracture. March fracture or fatigue fracture, shaft of second or third metatarsal bone. Let's move on. Now, burst fracture is a comminuted fracture of the vertebral body where multiple pieces burst out in different direction. So this is a burst fracture. It occurs in the vertebra. Clay-Chauveleur fracture. This is an avulsion fracture of spinous process of one or more of lower cervical or upper thoracic vertebra. Which is not very important question in the exam. Hangman's fracture. Now see that if this occurs in hanging process, and hanging is a type of capital punishment, isn't it? We have studied in forensic medicine. So what happens during that hanging? It is a fracture through the pedicle and lamina of C2 vertebra with subluxation of C2 over C3, and it is sustained in the hanging. There is an instant death in hanging, and usually because of that sudden jerk, these cervical vertebrae are fractured and subluxated, resulting in severe injury to the medulla oblongata. Remember, the name of the second cervical vertebra is called axis. This axis has a pointed part, and during hanging or hangman's fracture, this pointed part of the axis will damage medulla of the patient, of the person, I should say, not the patient, the person. So there is an instant death. Why there is an instant death? What medulla is having inside? Anyone?
Respiratory center.
Respiratory center.
Exactly. Exactly.
Very
Exactly. Every student knows that.
Cardiorespiratory center.
Very good. Cardiorespiratory center. That's why there is a sudden or instant death. Another type of fracture is a dashboard fracture. Dashboard fracture It's a fracture of posterior lip of the acetabulum, often associated with posterior dislocation of the hip. This is again associated with motor vehicle accident, okay, motor vehicle accident or road traffic injury. Now see here, so what happens if there is a sudden, stoppage of the car, and the car may be having the high speed, then suddenly your knee joint will stuck against the dashboard, and then this type of injury will happen. So this is dislocation of the hip with fracture of the posterior lip of the acetabulum. Now some other eponyms, okay, some other eponyms are also there, like straddle fracture, Malgagne's fracture, and mallet finger. This mallet finger is not usually associated with the fracture, but sometimes it may be associated with the avulsion fracture. So let's quickly go through them. Straddle fracture is a bilateral superior and inferior pubic rami fracture. Now this is a part of the pubis bone, and pubis is a part of the hip bone. Remember, our hip bone has three components: ilium, ischium, and pubis. So this pubic rami is a part of pubis bone. So there is a fracture of both superior and inferior pubic rami in straddle fracture. Malgagne's fracture is a type of pelvis fracture again, where there is a combination of fracture like pubic rami anteriorly and sacroiliac joint or ilium posteriorly on the same side. Not very commonly asked in the exam, but mallet finger, I have seen this question has been asked multiple times in the orthopedic MCQ paper. Now pay attention. This mallet finger is a finger flexed at the DIP joint due to avulsion or rupture of extensor tendon at the base of distal phalanx. Now what is the meaning of DIP?
Distal interphalangeal joint.
Distal interphalangeal joint. Distal
Exactly.
interphalangeal.
Exactly, very nice. Distal interphalangeal joint. So this is, okay, the finger which is flexed at the distal interphalangeal joint due to avulsion or rupture of the extensor tendon at the base of distal phalanx. So we all know the function of extensor tendon is extension of the finger or extension of the distal interphalangeal joint. Now that function is lost, but the flexor tendon are still doing their job. That's why the finger is acutely flexed. This is called mallet finger, and this occurs because of damage or rupture of extensor tendon. Now this is all about the different types of eponym. From the exam point of view, you need to remember Monteggia fracture dislocation, very commonly asked in the exam. Gallagher fracture dislocation, another one. Colles and Smith fracture, very commonly asked in the exam. Colles as well as Smith fracture. Bennett fracture and Rolando's fracture, and mallet finger. So many times, I have noted this type of questions are asked. And if you can, try to remember other as well. But do not give a lot of pressure on your mind, because it takes a bit of time to remember these names. Let's move on. Let's talk about what happens when joints are injured and what are the types of injury regarding the joint. Now, two important terms every student know: dislocation and subluxation. See here, if the joint is completely separated, okay, or the bones which are forming the joint completely separates from each other. Now you can see in this picture, this is dislocation. There is no contact at all. Whereas subluxation means there is still some contact between the bone in that joint. So we can say dislocation is a complete process and subluxation is a partial process. Dislocation is considered an orthopedic emergency. Always, whenever the patient comes to the hospital with suspected dislocation, it should be reduced quickly, instantly at that time. Otherwise, a lot of complication may arise. Now, We'll talk about all these specific joint dislocation in a subsequent classes. Probably in the second half of the class today, I'll talk about shoulder joint, okay, or shoulder overall. We'll talk about shoulder dislocation there, and hip dislocation will also be taught, okay, and just like that, elbow dislocation is also taught, because these are the three most common type of dislocation of the joint. Now let's move on to the injuries to ligament. When a ligament is injured, we call that sprain. Very commonly used medical term, a sprain. Injury to the ligament. Now let me underline this for you. Okay, sprain. Now this is to be differentiated from the term strain. And strain means when a muscle is stretched. Okay, when there is some damage to the muscle, or when there is stretching of the muscle, this is called strain. And sometimes the muscle is injured at its tendinous attachment as well. So don't get confused. Sprain is the term we use for ligament injury. Strain is the term we use for the pulling of the muscle or stretching of the muscle. And there are different grades of sprain or strain. Let's move on. Okay, now see there. Sprains are classified into 3 different degrees. You can see here a first degree, a second degree, and third degree. See that first degree is just probably a stretching. Only few fibers are damaged. In this schematic diagram that cannot be seen, because only few fibers are lost or damaged. Second degree, it is a partial tear. It is not a complete type of tear, a partial tear. And third degree, it's a complete tear. So this is the most severe type. First degree sprain is a tear of only a few fibers of the ligament, and it is characterized by minimal swelling, localized tenderness, but little functional disability. One of the important example I like to highlight here is an ankle sprain. Very, very common injury, okay, to everyone. For example, you are walking. Suddenly, you did not give that much notice on the ground. The ground was uneven, okay, and you twist your ankle. You will suffer from ankle sprain. Very common type of injury. In grade 1, there is a minimal swelling. If we press there, it will be tender, but we can still walk. You can still walk with pain. This is first degree sprain. What about second degree and third degree now? Second degree sprain is the one where anything from 1/3 to almost all the fibers of a ligament are disrupted, but still they are connecting with each other. Still, there's a slight connection with each other. It is not completely torn. And in this condition, the patient presents with pain. This pain is severe. Swelling is very pronounced, okay, massive swelling, and inability to use the limb. Now person cannot walk anymore in this second degree sprain. Joint movements are normal. Now, what do you mean by that? This is a passive joint movement, not active, okay? Active means the patient himself or herself is using the joint. That is not the case here. But passive is when we move the joint, it may look normal. The diagnosis can be made on performing a stress test by twisting the ankle in different direction. By moving the joint in different direction, we can diagnose this type of sprain. And third degree is the most severe type. It is a complete tear of the ligament. There is no connection between the two ends at all. And in this type, swelling is massive, pain is very severe. Okay. Now, sometimes, contrary to the expectation, the pain in such tear is minimal. It depends on the other, associated injury as well. Usually, in this type of complete sprain or third degree sprain, if the ankle is vigorously twisted, sometimes a small avulsion fracture may also be there. Now, if that is the case, the pain is very severe. But if it is completely torn, okay, and it's surprising to know that pain is not that much as the second degree sprain. Diagnosis is again can be done by performing a stress test. Stress test means twisting the limb in different direction, pulling the limb, and trying to know which ligament is injured, as well as some investigation like MRI. MRI is very commonly done to diagnose the ligament injury, okay, or even arthroscopy. Now, what is arthroscopy? What do you mean by that?
Sir, it is used for
Telescopic
the
We
examination of
put
a joint.
the tube and we watch the joints.
investigation as well as for treatment.
Good. Okay. So I'm sure every student know that arthroscopy is a type of, yes, yes, please. Somebody is trying to answer. Yes, I'm listening. Go on. Fine. Now let me say arthroscopy is a type of investigation inside the joint. It's a direct visualization or observation of joint cavity by inserting an instrument. You can easily say in a medical term, this is just like doing endoscopy of the joint. See this? It's so easy term. Doing endoscopy of the joint means we are inserting a special instrument called arthroscope into the joint cavity and we directly observe what is happening there. So these are different types of sprain: first degree, second degree, and third degree. Now, let's move on. A ligament may get torn in its substance or at either end. In its substance means in the middle part, or at either end means when it is attached to the bone. In the latter case, it often avulses with a small piece of bone from its attachment. That was what I was talking a little while earlier. Okay, if the injury is very fierce or vigorous type, a small chip of the bone may be pulled out because of the force of the injury. This is called avulsion fracture, and it is very commonly seen in ligament injury. So for the diagnosis, we need to take a detailed history and we need to do good examination as well as investigation. So what type of clinical examination we do? Let's talk about it, because this is a very common type of injury in orthopedics. During orthopedic practice, you'll come across many different types of ligament injury. Okay, so this is an important class. So please pay attention. A localized swelling, tenderness, and ecchymosis over a ligament indicates injury to that ligament. Let me again take the example of ankle ligament, because that is one of the commonest ligament which is injured in clinical practice. Ankle has different type of ligament. Deltoid ligament, okay, on the medial side, then fibular ligament we say is on the lateral side. So those ligaments are quite commonly injured or ruptured because of trauma. And how we know? There is a swelling, tenderness, and ecchymosis or bruise. This ecchymosis means bruise over the ligament. Usually a hemarthrosis is also noticed. Now what is hemarthrosis? What do you mean by that?
Bleeding inside the joint.
Bleeding in the joints.
Exactly. Okay, very easy meaning. Blood collection inside the joint cavity or bleeding inside the joint is called hemarthrosis. This hemarthrosis is noticed in second and third degree sprain, and that may take a bit of time. So within 2 hours, hemarthrosis may be seen or may be detected. But sometimes hemarthrosis may not occur even if the sprain is second or third degree. Okay, there are some exceptions. For example, hemarthrosis only occur if there is damage to the blood vessels, isn't it? Sometimes the blood vessel may not be injured, only the turn of the ligament occurs. So during that time, no hemarthrosis. And one of the exception is if the torn ligament is covered by synovial membrane, and that commonly happens in case of anterior cruciate ligament injury. This anterior cruciate ligament is present inside the knee joint. So if the synovial membrane of the knee joint is covering that torn part, there may not be any bleeding or no hemarthrosis. Now, we're talking about this stress test for the diagnosis of ligament injury. Now let's talk about it. What is this stress test all about? I already told you, you have to pull or twist the joint in different directions, okay, especially in that direction where that ligament is located. You know, a bit opposite to that, because ligament, for example, if we are dealing with the medial collateral ligament of the knee, which is shown in the picture, okay, you twist the knee or the leg in the opposite direction towards the lateral side, and there will be a stress felt by this ligament, and if it is ruptured or injured or damaged, the patient will complain of pain. In third degree tear or sprain, it is completely torn, isn't it? So what will happen if I pull or do the stress test? The joint will open up as well because ligament is completely torn. And if we take the X-ray during that time, we can see a bigger space, okay, between the two bones. Means the bigger space than the normal joint cavity would be seen. This is called opening up of the joint. So this is called stress test. Now, certain investigation we like to do in this type of cases are, of course, plain X-ray. Plain X-ray is always done, okay, whenever we suspect any ligament injury or any joint injury or any bone injury. Always do. But most of the time, the plain X-ray of the joint is normal because the ligament rupture or injury cannot be seen by plain X-ray. Sometimes, if avulsion fracture is associated with a ligament injury, then a chip of bone may be seen separated from the main bone there. Okay, so we already know the mechanism for that. This is associated injury. There is one special type of X-ray which is known as stress X-ray. Now, what do you mean by that? While doing that stress test, okay, we ask the person to take X-ray, and if there is third degree sprain here, now what happened? Third degree sprain, there is abnormal opening up of the joint. This can be detected by stress X-ray. So this is one of the important investigation in this case. Remember, stress X-ray is negative in case of first degree and second degree sprain. It is only present or positive in third degree sprain. Now, other investigation are MRI or arthroscopy. These are also very routinely done. Arthroscopy is commonly done in case of knee injury because knee has so many different ligaments there. Sometimes, following a complete tear of ligament, the blood seeps out of the joint through a small tear in the ligament itself, and it appears that there is no hemarthrosis. So we need to make sure there is no external wound there. Okay? There is no any site from where blood can be lost outside, and that may be the cause for no detection of hemarthrosis. So we need to be careful. Now, what is the treatment? Very, very important, a general discussion this. Many of us will suffer from this type of injury in daily life, okay? So please pay attention here. There has been a significant change in the treatment of sprain these days. All sprains are treated initially with rest, ice therapy, compression bandage, and elevation of the limb. In short form, it is called RICE therapy. See there, R stands for rest, I stands for ice therapy, C stands for compression bandage, and E stands for elevation. This is very commonly done in the treatment. Because the person is having severe pain there, rest will be advised. Ice therapy. Now, what is the advantages of putting ice there or compressing with ice? What ice
to
is
to
doing there?
Compression,
to
blood
decrease the
vessel,
inflammation,
compression of the blood
due to the
vessel.
vasoconstriction.
Good, very nice. Okay. Now there are two important points here. One, it will cause constriction of the blood vessel, so there will be decreased edema. The swelling is decreased. This is very important one, and this excessive swelling is causing a lot of pain. So pain will also be reduced because of this ice therapy, because it has already decreased the swelling. So this is very important point. So ice therapy is commonly done in the inflamed area or any injured site. Compression bandage has the same type of purpose. It again doesn't allow that swelling to reappear again, and elevation of the limb again decreases the swelling. Suitable analgesics and anti-inflammatory medication is given. Now you all know what are those in orthopedics. These are the same type of NSAID drug which we use all the time. NSAID, okay, non-steroidal anti-inflammatory drug. Diclofenac is one of the most commonly used drug in orthopedics practice. Ibuprofen is another one. So all those examples and they are routinely given. This is enough for first degree sprain. This much anybody can do that. Okay, we don't need any advanced type of treatment regarding these things. Whereas second and third degree sprain are immobilized in a brace or a plaster cast for a period of 1 to 2 weeks, mainly for pain relief and immobilization. Pain relief and immobilization. Now, why is that? Because second degree sprain, the person cannot walk. The joint function is lost, and it is almost the complete type of tear. Whereas third degree sprain is a complete rupture of the ligament. So these are serious type of injury. So to immobilize that particular joint, we need to put the patient into a plaster cast or the brace for around 1 to 2 weeks. We do not advise for longer immobilization. Okay, around 2 weeks may be enough. If longer immobilization is advised, then a lot of other complication would be there. After that, you advise for early mobilization and walking with support, because a little bit of pressure is required for the proper healing or better healing, and that is provided by early mobilization and walking. In some third degree sprain, surgery may be required. Definitely, it's a complete type of rupture or tear, isn't it? So surgery may be required. It depends what is the importance of this ligament to the joint. If you believe it is a very important type of ligament, better to suture it together. This is done by surgery. Now, after discussing this very important, practical type of class, let's talk about some other, like injuries to the muscle and tendon. Now, I like to ask one question before I move into the discussion. What do you mean by tendon? What is tendon?
Connect muscle with the bones.
Connection between muscle and bone.
Very good. Okay, I'm sure 100% of the students know this answer. This is the connection between muscle and the bone. Tendon is present on either side of the muscle. Okay, tendon. It may be present towards the origin of the muscle. It may be present towards the insertion of the muscle. And the middle part of the muscle is called belly. Belly is the main part of the muscle. Now you already know the meaning, so let's talk about it. Muscles are ruptured more often than tendon in young people, while the reverse is true in the elderly, because those tendons are a bit of degenerated in the older people. The most frequent cause of partial or complete rupture of a muscle or tendon is sudden vigorous contraction of a muscle. Sudden vigorous contraction of a muscle may pull that tendon from the bone or may rupture few of the muscle fiber. It may also be caused by overstretching of a muscle at rest. Now, we already know such injury to the muscle is termed as strain. Okay, strain. Never forget this. Strain, very commonly used medical term. Whenever we think the person has a muscle injury, we call, yes, that person is having strain. Whereas ligament injury is called sprain. Now, another mechanism of injury may be by sharp object such as a sword, which may cut through the muscle or the tendon. This is a severe type of injury. Now, regarding the pathology of this injuries to the muscle and tendon, let's talk a little bit about it. A rupture occurs within a tendon only if it is abnormal and has become weak, either due to degeneration or wear and tear, which usually happens in older people. Already they have some amount of degeneration, or because of some diseases like connective tissue disorder. Okay, the tendon may rupture easily. Diagnosis of a ruptured tendon is usually easy, because when we ask the patient to actively flex or extend that particular joint, the function of the muscle will come into the picture. And if tendons are already damaged, that thing cannot happen. The patient cannot do those type of function. In other words, some passive movement of the joint can also detect that. Now, what are the common sites of tendon rupture? Now, see here, these are the common tendon which are ruptured in clinical practice. Supraspinatus tendon. Now, where is this muscle present? Supraspinatus? Yes?
On the back. On the back.
Okay, on the back.
One
Okay.
of the sit muscles.
Good. One of the sheaths muscle. Okay, I already got the answer. Excellent. This is the muscle which is associated with scapula. Okay, scapula, supraspinatus muscle. It is present on the upper back. It is attached to the scapula. Supraspinatus, infraspinatus, teres minor, and subscapularis. These are called sheaths muscle. In the next coming class, we are going to talk about them. Okay, they are called rotator cuff muscle, supraspinatus. So it is one of the common tendon which is ruptured in a shoulder injury. Achilles tendon, every student know where it is. So where is Achilles tendon? Yes,
leg.
exactly.
In the lower limb.
It's the lower limb. Yes. So it is formed by some particular muscle. Can you tell me which muscles are they?
Gastrocnemius.
Gastrocnemius and soleus.
Exactly. Gastrocnemius and soleus. Okay. So let me write that. Gastrocnemius and soleus muscle. These are the very strong muscles of our calf, and the tendon which is associated with this muscle is known as Achilles tendon or tendocalcaneus. This is the strongest tendon of our body, and without this tendon we cannot walk. Very commonly injured in clinical practice. Biceps tendon, usually the long head of the biceps. Now we all know where is biceps muscle, isn't it? Very easy question for you. So it is present on the anterior compartment of the arm. Anterior compartment of the arm, biceps muscle. And the functions of the biceps is flexion of the forearm and supination of the forearm. Very important muscle. Extensor pollicis longus tendon. Now where is this muscle present? Yes, where?
Forearm, back of the forearm.
Good, very good. Forearm, you can simply say forearm. Pollicis, okay, is the term we use for the thumb. Pollicis is the term we use for the thumb. So of course it is present in the upper limb, in the forearm, especially in the extensor compartment of the forearm or you can also say back of the forearm. Quadriceps tendon. Okay. Now, what are the muscle that forms quadriceps tendon? What
Three
are those?
vastus and one rectus.
Very good. Very good. I already got the answer. Excellent. Three vasti and rectus femoris. See here, three vasti and one rectus femoris. Okay, that's why there are four muscles, and the term is quadriceps. Okay, quadri means four. So vastus medialis, vastus lateralis, and vastus intermedius. These are three vasti and rectus femoris. Together from quadriceps femoris tendon. Another very strong tendon which is attached to the upper part of the patella, and from the lower part of the patella we have ligamentum patellae. Now that ligament term is a misnomer here. Actually it is not a ligament. Okay, so ligamentum patellae is a type of tendon. It is extension of the tendon, you can say. And okay, if we want to talk in a bit of detail, this patella is a type of sesamoid bone. Now, what is sesamoid bone? Who can answer?
Bone between two tendons or ligaments.
Tendon.
Yes. Anybody else? I want to hear a bit of more answer here. What is sesamoid bone?
Not attached to bone.
Okay.
Which is covered in a tendon, inside tendon.
Okay. Now the answers are coming. Okay, you are almost there, but proper term would be if a bone develops inside the tendon, it is called sesamoid bone. Now, just think about it. From the quadriceps tendon, okay, it is the quadriceps tendon. The lower part of the quadriceps tendon is attached to the upper part of the patella, and from the lower part of the patella, the ligamentum patellae arises, and it inserts into the tibial tuberosity. So, if we think in a broader picture, this whole tendon, which is coming from the quadriceps femoris, is going towards the tibial tuberosity, and that sesamoid bone patella is developed inside it. That's why this is very important example of sesamoid bone. Okay, now you already got the meaning. So quadriceps tendon is another common tendon to rupture. Okay, and patellar tendon is ligamentum patellae. So these are the important example. Now we are coming towards the end. What treatment we like to provide in case of injuries to muscles and tendons? See there, the best treatment of a fresh rupture is to regain continuity by end-to-end repair. If tendons are completely ruptured or damaged, we need to do suturing or end-to-end repair of those tendons, because tendons are very important for the functions of the muscle. Think about it. If tendons are completely damaged or separated from the insertion site of the origin site, that muscle will lose its function. So it is a very important type of treatment. When the gap is too much, it can be filled with the help of a tendon graft. Okay, this is a special type of surgery. In cases where the repair is not possible, a tendon transfer may be performed. So nearby muscle, we can do the tendon transfer from the nearby muscle of the tendon. In some old tendon rupture, especially in the elderly people, like more than 75, 80 or 85-year-old, there may be only a minimal functional disability because they have already lost most of the functions of their limbs. Okay, so probably all those difficult type of surgery we won't do at that time. Those type of treatments are avoided. Okay, and these patients do well without treatment as well. Now with this, I have concluded this important topic, very important practical topic actually. Okay.